Hello, my name is Matthew Genco. I am an upcoming senior at St. Ignatius High School, and I am part of the radiology internship program. My project is titled Calculation of Radiation Dose to Tumors from Radiomicrosphere Embolization in Unresectable Liver Cancer using Y90 PET. The authors are myself, Matthew Genco, Dr. Neicheng Yu, PhD from Radiation Oncology, Dr. Frank DiFilippo, PhD from Nuclear Medicine, and my mentor, Dr. Sham Srinivas, MD, PhD from Nuclear Medicine. The background of my project, radiomicrosphere embolization using yttrium-90, is one of few options to treat patients with unresectable liver lesions. The yttrium is encased in tiny spheres, called microspheres, which emit beta particle radiation. The Y90 microspheres are inserted via catheter and targeted to embolize the vasculature of tumors within the liver. The spheres become embedded in the capillaries, which supply the tumor and emit beta particles to destroy the tumor. Regression of the tumor results in a successful treatment. Y90 PET gives a quantitative map of microsphere distribution, allowing us to determine the radiation dosage to tumors. The problem is that the current algorithm to calculate the amount of activity to be administered is based on delivering a uniform dosage measured in gray, which is based on the volume of the lobe of the liver. Nowhere does the volume of the tumor or the desired dosage to that tumor enter into the dosimetry calculations. The hypothesis is a convolution algorithm can take advantage of the quantitative map that is provided by Y90 PET by modeling the effects of multiple point sources and determining the average grade to a tumor. The quantitative accuracy of a convolution algorithm can be assessed by using a volume of interest, VOI, analysis on a Y90 PET scan as a standard. The methodology. 22 patients who underwent Y90 treatment and had post-therapy PET-CT scans were candidates for this study. Pre-therapy scans, both MRI and CT scans, were evaluated to locate the tumors and determine their sizes. The lobar and tumoral distribution of Y90 was observed. Contours were drawn around the tumor and normal liver by analyzing both the pre-therapy scans and the PET scans using specialized software, MimVista, which is based in Cleveland, Ohio. A total of 85 contours were drawn and affirmed by my mentor, Dr. Srinivas. The contours were run through a program using a convolution algorithm that ascertains the mean grade given to each tumor. For verification, the same contour was treated as a VOI, and the mean becquerel per ml was found. This number was then converted using isotope branching fractions to calculate the mean gray given to a tumor. The mean gray found via the convolution algorithm was then compared to the mean gray found via the VOI analysis. This comparison was made by percent error. Here's a first pre-therapy example. This is a pre-therapy MRI case where the observed tumor in segment 3 is 4.6 centimeters by 4.3 centimeters, and the tumor is right here in this area. It's very noticeable on the scan. This is the Y90 PET CT with contour. It is a fusion from the day of the treatment using Y90 microspheres. A mean delivered radiation dose of 174 gray was given to the tumor. The outline of the contour is drawn here in accordance with the pre-therapy scan. This is the post-therapy MRI, which shows success. The observed tumor has decreased in size and now measures 2.6 centimeters by 2.2 centimeters. This scan was taken 16 weeks after treatment. The tumor can be seen right here, and it has obviously decreased in size. This is a pre-therapy example number 2, where the treatment was possibly a failure. This is the pre-therapy CT. The observed tumor in segment 6 is 6 centimeters by 4.7 centimeters, and you can see the tumor right here. This is the Y90 PET and CT with contour. This is the fusion from the day of the treatment. The tumor is treated using Y90 with a mean delivered radiation dose of 40 gray. you can see the contour right here. An annulus is drawn because the center of the tumor is necrotic, which causes it not to uptake the yttrium-90 on the scan, where the outside rim of the contour is live tumor, which uptakes yttrium-90. This is the post-therapy CT, which shows failure. The tumor likely did not receive enough radiation, which may have caused the treatment to fail. This is the post-treatment CT, and the observed tumor has increased in size to 9.2 centimeters by 6.2 centimeters, and this image was taken 16 weeks after treatment. You can see the giant tumor right here, and there are also other tumors right there, some right there, and in other slices there's a tumor up here, which obviously means this treatment was a failure. This is a graph that shows the dosage of gray given to a tumor. On the left is the measured dosage in gray from 0 to 700, and here is the convolution algorithm, which is the first way we calculated the amount of gray. And here is the VOI analysis, which is the second way that the gray was calculated. Empirically, for a therapeutic efficacy, the liver lobe is treated with 120 gray. The previous chart displays the amount of gray given to 51 tumors based upon the two distinct ways it was calculated, convolution algorithm versus VOI analysis. As can be seen, the dose measured by the convolution algorithm is consistently lower than that of the VOI analysis, with the exception of two contours. The average percent error using the VOI analysis as the standard value was 17%. This is the second chart, which measures the dosage given to normal liver non-tumors. On the left, once again, you have gray, which is measured from 0 to 700 gray. For comparison purposes, the same values were kept the same. On the left is the convolution algorithm, and on the right is the VOI analysis. And it is apparent that the normal liver did not receive any gray dosage above 300 gray. The previous chart displays the amount of gray given to each 34 normal liver contours based upon the two distinct ways it was calculated, convolution algorithm versus VOI analysis. As can be seen, the dose measured by the convolution algorithm is consistently lower than that of the VOI analysis, with the exception of three contours. The average percent error using the VOI as the standard was 18%. Note that many livers received greater than 120 gray. Data collection and analysis. 85 contours are drawn, 51 of which are tumor contours. 34 of the contours are normal liver contours. The average tumor received 198 gray, and the average normal liver received 93 gray. And this is according to the convolution algorithm. Percent error was calculated for each contour by using the VOI analysis results as a standard value. Average percent error for the tumor contours was negative 17%. The average percent error for the normal liver contours was negative 18%, and the average percent error for the entire study was negative 17%. Conclusion. Agreement between the convolution algorithm and VOI analysis values for gray to tumor is reasonable, with a percent error for tumor contours of negative 17% and for normal liver contours of negative 18%. This establishes the convolution algorithm to be an acceptable method to calculate the amount of gray given to any location of the liver, be it tumor or normal liver. The clinical utility of absolute quantification of radiation exposure to individual tumors may give us the ability to predict whether patients will be responders or non-responders to radioembolization. Furthermore, quantitative assessment of normal liver tissue and extrahepatic tissues, if the case may be, may help predict which patients develop adverse events or side effects. Taking advantage of the dose map that is provided by PET-CT shows the heterogeneity of Y90 distribution, which adds a layer of sophistication to the existing empirical uniform dosimetry, which incorrectly assumes a homogeneous distribution throughout a lobe of the liver. Future recommendations. Further investigation is needed to ensure that the VOI analysis is accurate as a standard. The following experiment is proposed. Different known amounts of Y90 microsphere activity will be placed in a water-filled acrylic phantom. A PET scan of the phantom will be obtained, which will give an estimation of the amount of activity that is in the phantom. A VOI analysis will be run, and the activity on the image will be compared to the known activity in the phantom. The degree of discrepancy will determine how accurate the VOI analysis is as a standard. Finally, thank you to Dr. Srinivas for his guidance and help throughout this entire process. Without him, I would never have been able to do this project. Thank you to Dr. Yu for his help and the convolution algorithm that was calculated the grade given to the contours. Dr. DiFilippo for his help in VOI analysis that was used as a standard for my project. The Departments of Nuclear Medicine and Radiation Oncology for the accommodations made for me. And finally, to Ms. Starling and the entire summer internship program for this wonderful opportunity. Thank you.